All right, well, I am excited to introduce you all to a new friend, Heather Champion, and we're going to be talking about chiropractic care again today from a little bit of a different angle. But first, I really just wanted to introduce you to my new friend, Heather Champion. Hey, Heather.
Hi.
Tell the community just a little bit about yourself, about your family.
Sure. So my name is Heather Champion. I am married. I have a daughter who is 6 years old. We just moved to the Hendersonville area from Florida. It'll be a year in March.
Wow.
And I just opened my practice. This is my first time owning a business. So I just opened up in October. So I'm just working to grow and kind of get out in the community and meet more people and just get this business off the ground.
Wow. Well, welcome to Hendersonville.
Thank you.
And man, it's so great to have you here. And y'all, I know you've noticed the increase in the quality of our workout videos. That is thanks to Heather and her beautiful space here over in Glenbrook. So y'all, big thanks, Heather, for
Absolutely.
opening your doors to the community and to our videos. It's been so awesome to be able to spread out a little bit more and be able to increase the quality of what we're offering. So Heather's actually joined the community also. So let's dive in. So we've talked a little bit in the community. I know you're already a little bit familiar and you and I have talked, but we are a community of women who are pursuing health and wellness from all angles. So, we're definitely covering the fitness aspect, working out together, but we also have lots of conversations about a holistic wellness care plan.
Sure.
So I'm also a nutritionist, so we talk lots about healthy eating. So important, but also about managing stress and then caring for our bodies as we age in lots of different ways. And I found just a great deal of help and relief through chiropractic care over the years. I started to have migraine headaches, and so wasn't able to really get a medical diagnosis, but started doing regular chiropractic care and have been able to really keep those away with chiropractic care. But additionally, as a fitness professional, there are so many benefits to exercise and it's so important, but we can also throw things off and throw things out.
Yep.
So let's start by, why don't you just tell us a little bit about what is chiropractic care?
Sure. So chiropractic care is, the boring definition is a non-invasive form of managing functional fitness and functional wellness. So from my perspective, I enjoy looking at people from a whole person perspective. So how is the body moving? How is it functioning? What kind of imbalances do we need to address? And then we look at that from not only the muscles, but neurologically, as well as the spine. Is the spine functioning? And then how that's affecting everything else.
Man, we have that in common for sure. Really looking at the whole package and what's going on, because it's usually not just one thing.
Oh no,
because we are a whole people, but we're also complex and intricate. So tell us a little bit about your model or your approach to care.
Sure.
And how maybe it's different, or really just how you like to approach a patient, or just your model in general.
Sure. So typically in my office, I do a detailed exam on every patient. So like I said, looking at them from a whole person perspective, we ask lots of questions. We really get a feel for why they're there and why they are having this pain, kind of rooted in a little bit of history and kind of breaking that down. And then once we get every information together from that history, from that exam, I put it together and then we just sort of talk about it. And I like to develop a plan. So that plan is going to have a couple different phases. If you're struggling with an injury, that first phase is going to be pain relief. Obviously, I want you to feel better. And then the next phase is going to include, how do we get back to our normal daily activities? So I like to focus with stretching and then exercises. So, I know you're a big fan of those. I absolutely love rehab. So I take every patient through that rehab care so that they can get back to normal daily activities. And that isn't always thought of with chiropractic, is that rehab care, looking at the muscles, but it really is such an important part of it, retraining the body to function like it's supposed to, which sometimes isn't how it already was functioning.
Yeah, so I'd love to hear more about that, about what you mean by rehab care. We do focus a lot in the community on, I call it yoga fusion, Pilates fusion, flexibility fusion, yes, but on the importance of taking the time to stretch.
Okay.
So talk to us a little bit about what you mean. Like, what is your rehab care plan?
So,
in addition to, obviously, you're doing the adjustments.
Right.
You're making sure things are where they're supposed to be, which actually I had an adjustment before this. I wanted the full experience, and I feel amazing.
So I like to tell people that your body is a team effort, right? We got a whole team of players. They all have their position of what they're supposed to be doing, but we have some slackers and we have some MVPs maybe taking up for that slack. So I look at balance and imbalance. So with a low back injury, sometimes the issue is not really stemming from where the pain is. The issue is stemming from where dysfunction is. So I'm looking at, okay, are their quads and hip flexors tighter than their hamstrings, pulling that body forward, putting strain on the low back? Do they have a weak core that can't balance out that low back? So when they come for example, a low back injury, their rehab might include things that are stretching of the hip flexors, stretching of the hamstrings, core strengthening, things that we don't always put together with low back strain. I have a lot of patients that come in and they think that for a low back injury, they need to strengthen their low back. Well, that might not be the case for them specifically. It might be that the low back was just fine. It's just working too hard because it's the only one working.
That's so great. And that's actually a really, thank you for that. That's a great way that we could work together, because we focus a lot and we talk a little bit in the community about muscle imbalances, particularly with posture and, with sitting at a computer, being on our phones, how these muscles in the front get tight and overworked, and the muscles across your upper back get lengthened and underworked. So I love that, adding that your additional knowledge of the skeletal system, of the spine, with then being able to prescribe specific stretches. I love that.
I think personal training is an important next step with care with chiropractic. So if my goal with a patient is to getting them back to their normal activities, and for most people that includes exercise. So my goal would be to get them somewhere where they can work one-on-one. So that's why I love our relationship here, because I can get someone to the point where they need that one-on-one, they need that exercise. They're not rehabbing an injury, they don't need me anymore. So sending them to that fitness realm, just a smooth transition. It's just necessary for life, taking care of yourself like that.
Absolutely. And then being able to pop back in, as we learn our bodies, and that's something I really encourage my clients and my community, is to learn to listen to your body.
Oh yeah, it's going to tell you.
Exactly. And so, I'm very aware. It's not uncommon for me to throw a rib out of alignment, and then I usually am able to come and say, hey, I've got something out, help me, because what can happen if you don't address those misalignments over time is that our muscles compensate. Yes. We've got all kinds of compensations that can happen. Can you talk to us a little bit about that?
It just goes back to that team effort again. So your body has to keep moving. You have to keep doing your daily activities. And to do that, you got some that are working really hard to make up for some of those that are slacking. So then that becomes this just this downward spiral of, okay, tight hip flexors, weak hamstrings, weak core to balance out the one side tight, one side weak. And down the road, it can lead to muscle strains. We actually see with some of those imbalances, it can lead to disc herniations. It can lead to other kind of bigger, scarier words.
Injury.
Yeah, injuries, muscle strains, absolutely.
Yep.
So that preventative maintenance, I
Yes.
like to call it like performance care.
Yes.
To stay ahead of those, catch the imbalance and the dysfunction before it becomes a pain.
I love that so much. Y'all know I love that so much. As much as we can,
Yeah.
focusing on caring for ourselves, but really that it really is preventative
Yes.
care.
Yeah.
So I'd much rather spend the energy taking care of my body on the front end, than
Right.
doing injury rehab.
Absolutely.
So Heather, I know that you offer some other services here. Will you tell us a little bit about what other services that you offer?
Yeah, so in addition to chiropractic, I do a lot of muscle work. So I love cupping and something called instrument-assisted soft tissue. It's got a really long name, but it's a scraping technique to break up fascial adhesions. And then I also have two amazing female massage therapists that work for me. They've both been in practice for, 10 to 15 years each, so they're fantastic. And it just goes hand in hand with what I do, and then whole health perspective as well. That massage, that muscle care, that relaxation time, de-stress. And then if they do that massage first, then once they come to me, gosh, my job is so easy.
Vice versa.
Yeah.
Tell us about cupping.
Yeah.
What is cupping?
Oh my gosh. So it gives similar benefits to massage. So there's a couple different ways of doing it, but I use just a simple, it's a plastic cup with a suction handle.
Okay.
And you place it where the body needs it most. So in areas of really tight muscles, you can do it around areas that even have strain. And it lifts the skin up to increase that space between the muscle and the fascia. It increases blood flow, and so brings in good inflammation to promote healing. Sometimes it'll leave little marks. So if you've been...
Or not so little marks.
Or not so little marks. So I think Michael Phelps with the Olympics a few years ago, you could really see he had this just polka dot appearance down his back. That was from cupping. It was to help alleviate some of the muscle tightness that he was getting from overtraining a little bit, but
but
awesome.
you've seen people have lots of success with that.
Absolutely.
Relief.
Yeah, I mean, they can come in and be so tight that they can't bend over to touch their toes. I do 7 minutes of cupping before I do any other treatments, and they can touch their toes.
Okay, and then what was the other method you mentioned?
Yes, it's called instrument-assisted soft tissue mobilization.
I love that.
Whew. So it is a stainless steel beveled tool, and you use it as a scraping motion, and so that is, again, breaking up those fascial adhesions. You can really get into that muscle, really get into muscle knots. So again, similar benefits to massage.
Yeah, so help me. Okay, so we'll geek out for just a second before we move on. So, from a training perspective, we focus on those adhesions with static stretches.
Yep.
But you're taking it a step farther and really getting to where...
so you can actually do them together.
Okay.
So hamstrings, if someone has just those intensely tight hamstrings and they're like, oh, I've had tight hamstrings my whole life, they'll never be flexible. You can do a static or even dynamic hamstring stretch while doing that instrument-assisted soft tissue scraping and just double your results.
And get that muscle to loosen up,
Absolutely.
to relax. Maybe then you're also able to hit at if there's something that's causing it to be extra tight.
Absolutely.
To flow and move like it's supposed to move. Function like it's supposed to function. Yes, which functional fitness, I'm all about functional fitness because we want to be able to be up and down on the ground with our kids and eventually our grandkids and, agile and able to live life really to the full.
Yeah.
So
take care of them until you take care of you.
That's it. All right, Heather, what other, do you have any advice or wellness, we talked about a preventative approach. We've hit on a lot of different things. What would you encourage our community with?
I would say the biggest thing that we already touched on was listen to your body. Your body's going to tell you when something feels a little bit off, and it's our job to just listen to that. So you take that information, and then from there, then I can help you find that imbalance and find what your body is telling you.
Yep, and I can already tell y'all after spending just a few minutes with Heather and her checking me out. I mean, she was spot on, and I already feel looser. So Heather, if the ladies want to come and see you, if they want to address an issue that maybe we can't get at just through fitness, or flexibility, how do they get in touch with you? And then I think you've got a special offer for us.
Yes. So I'm located if you're in the Hendersonville area, I'm in the Glenbrook Shopping Center where the Target's located, a little off of that. I have a website that we'll put up, and you can actually access the schedule and all that information from that website. And then if you are in the area and want to come see me, just mention that you saw this conversation or met me through Cassidy, and 15% off your first visit of either chiropractic or massage.
Gosh, thank you so much. And we just can't thank you enough for sharing your space with us and sharing your expertise. I'm excited, y'all. I encourage you to make your appointment. It really is. I am all about a holistic preventative care plan to take care of these bodies so that we can be fully present to life, to be the best that we can be with the time that we have. So Heather, I can't thank you enough for your time.
My pleasure.
And y'all, we'll be seeing you around. Thank you.